Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show, living a longer and healthier life. As always, we got an action-packed program this evening. We're going to take you on an adventure of health. We're going to talk a lot about internal medicine, and kind of go into a little bit more about nephrology and the kidneys. So, as always, you can see the shows on allcountyhealthcare.com. So if you miss anything or you want to go back, I hope you're listening on the radio, because I know it's rainy out there, and today is probably a perfect day to either listen to the radio at home or driving around. But if not, remember, allcountyhealthcare.com. Go back and see the show. Or on Facebook, as I'm doing right now, we're live. So you can go to All County Healthcare's Facebook page and see us there as well. And when I say us, without further ado, I'm going to introduce tonight's guests. So Dr. David P Selzer, Dr. Selzer, he's internal medicine. He's with NYU Langone Medical Associates in West Palm Beach, actually on Clematis Street, one of my favorite places in South Florida and West Palm Beach there. So, Dr. Selzer, welcome to the program. How are you doing this evening?
I'm doing great this evening. Happy to be here.
And thanks for taking the drive down and, like I said, take us on this adventure of health. I want to get right into it. So, I have a lot of questions about the kidneys and internal medicine. We don't really talk much nephrology on this program. One of the reasons I really wanted to have you on. But help me out and tell me a little bit about what nephrology is, because it's a term I don't run into very often as a newspaper reporter.
So nephrology is a subset in internal medicine. It is the study of kidney disease and all its parameters. So nephrologists will focus on diseases such as anemia, as the kidney produces epigen that helps make more red blood cells, hypertension, as a lot of sodium disorders cause high blood pressure, along with all types of electrolyte disturbances, such as potassium disturbances, acid-base disturbances. So therein lies your focus of nephrology.
And starting the first term you mentioned there, anemia, I think I'm a little familiar with that. Is that a blood disorder?
Yes, that is a blood disorder. Typically, patients who have kidney disease will have a decrease in red blood cell production. That's because you will have a decrease in hemoglobin, a decrease in RBC production will cause a decrease in hemoglobin. So what nephrologists do is we analyze what is the root cause. We do like a root cause analysis, essentially, and we figure out where is the problem and we fix it. That's sort of our job.
That's really neat because, like I said, we don't get to talk about the kidneys very often. One of the things that we always seem to run into on this program, I have a lot of podiatrists on the program, we get a lot of heart surgeons, cardiologists, etc. Diabetes. It's a huge topic in this country. I feel like when I was younger, I never even ran into the term. I mean, even my grandparents, I'm sharing my, kind of making me as a case study here, but historically, I mean, grandparents didn't have it on either side as well. So I wanted to talk to you a little bit about how diabetes affects the kidneys? Because is that one of the first places that diabetes can be found in terms of an ailment? And if so, how does it affect the kidneys?
So I think that in regard to the first point that you made about not hearing about it until now and sort of later on in life, I think that's a credit to the medical community and to endocrinologists and internal medicine physicians, because they're taking better care of people who have diabetes, and therefore they're living longer, so more people have it. Sometimes when more people have a disease and it becomes more well known, then it's heard about more because it's more prevalent, because people are being able to care for it, and becomes what we call a chronic disease versus a deadly disease. Now, in regard to how does diabetes affect the kidney, diabetes is essentially increased amount of sugar inside the body. And people always talk about, oh, my sugar level is 250, my sugar level is 150, I had to take more insulin, I had to take less insulin. So now that we understand that there's more glucose inside the body, more sugar, the kidney's job is to filter that sugar. When you have an increased amount of sugar in the kidney is going to make a decision. Either I'm going to reabsorb it into the body, or I'm going to let it go out into the urine. So you might ask yourself, when the glucose is too high and it's going into the urine, what would be the problem with that? Well, there's two problems with that. Number one is when glucose is inside of urine, it's sort of like a big party for bacteria. Bacteria love glucose, and then it can cause major infections. So when you have all that glucose, you have an increased amount of urinary tract infections, and I hope you've never had one, because they can be extremely painful.
No, I normally hear about them in women, to be honest with you.
Yeah, women have it much more often, and especially in pregnancy, women get it much more often, and we're much more aggressive in regard to treating with antibiotics, because the area between the orifice through the vagina to go back into the kidney gets widened, and therefore you have the bacteria are more likely to go back into the kidney itself and then cause a pyelonephritis. So especially women who are pregnant, we're much more at risk for urinary tract infections generally, forgetting diabetes. But if you become a diabetic and you have excess sugar going into your urinary tract, you can you're much more likely to get a urinary tract infection. And secondly, one of the bigger problems is, the kidney's not made to work so hard. All of a sudden, you're asking the kidney to reabsorb all this excess amount of sugar, and then what it can reabsorb at a set point, it starts going into the urine. Then all of a sudden, that causes distress to the kidney, and you start losing kidney function because of it.
Unbelievable. I did not know that with the bacteria, that point you made. And before I forget, there was I've only had a couple cases in my life where I've actually known a man to have a urinary tract infection. Mm-hmm. And correct me if I'm wrong, but both times were after a surgery because of catheter had to be placed, and maybe there was bacteria got into the system that way. But that's an interesting point. I never knew that diabetes can increase the risk of urinary tract infections in men and women.
Yeah, it's all the sugar. People like sugar. Bacteria love it, and that makes it grow. It's the greatest party for bacteria. You put E. coli and glucose together, and there's no party like it.
See, I didn't know that. I mean, where else on the radio or in South Florida or globally can you find this info but here on the You and Your Doctor show? I mean, I learned something every time we have a doctor on, but that is just fascinating. I don't really have that, obviously, scientific or a physician background, but I've been doing the show 3 years, I told you, in the green room there, and never heard that. So thank you.
You're welcome.
That's what we're looking for on this show. That's great. So we're here with Dr. David Selzer. He's internal medicine, so he's an internist, but I think the way to describe it is a special interest in nephrology.
Yes.
Which is obviously study of the kidneys and diagnosis and treatment for kidney ailments. So very important, especially as he told us when it ties in to diabetes. Another thing we always talk about on this program, and I always share a little bit about my health history because, you look at my size, we got to do something here, but I'm still good for now. I always share it with everyone, but, it's kind of like a ticking time bomb. And one thing they always, internists always check with me, my internist, about every 3 months is for high blood pressure. And in terms of the kidneys, how can high blood pressure affect those kidneys? So everyone's got 2 kidneys.
Everyone has 2 kidneys.
Well, not everyone, but yeah.
As I always say, nobody says, "Oh, I'm born with 1 kidney," until you actually have an ultrasound, and they're like, "Voila, it's not there." So the way it affects hypertension can affect the kidney is that the main cell of the kidney is the glomerulus. And we talk about that there's inside glomerular, the glomerulus pressure. So you have an increase of intraglomerular pressure. The way doctors generally treat it is with 1 or 2 classes of medications. One is an angiotensin converting enzyme inhibitor, otherwise known as an ACE inhibitor, or an angiotensin 2 receptor blocker, or otherwise known as an ARB. They're under the same umbrella of medications. So an ACE inhibitor would be a captopril or enalapril. Some of our listeners are taking that medication. Or an ARB is losartan, valsartan. Now, there's different reasons why a physician might choose one versus the other. Typically, we start with ACE inhibitors, and if the patient can't handle an ACE, we go with an ARB. And what that does, it sort of decreases the pressure inside the kidney in and of itself, and therefore allows the pressure to go down, and it helps the kidney survive. Because when you have that increased pressure, what you're going to also have is an increased amount of protein spilling into the urine. That's one of the reasons why your doctor will always check for protein inside the urine. And one of the indications for an ACE or an ARB is if you have protein in the urine, the first step that the physician should do is you should be started on an ACE or an ARB.
Okay, I see. So that's why the physician's always asking for the urine test and the blood test before certain, appointments. Because they have to read that.
You have to read it. It's even better when you look at it under a microscope. You know, I'm a nephrologist, so I just love urine, and I love looking at it and studying it. But I think every physician, internal medicine, nephrology, every cardiologist, it's very important to do urine studies to have an idea of have what's coming out of you and what's sort of legitimately and accurately leaking out.
I sometimes forget, physicians are biologists as well, and you're always studying and researching, and, sometimes we forget that. But that is great news that we have someone of your expertise right here in South Florida. I'm going to give out the info again because we're going to take a quick break, but it's Dr. David Selzer. He's internal medicine, so an internist, NYU Langone Medical Associates, West Palm Beach, 101 North Clematis Street, Suite 110 in West Palm Beach. Again, 561-365-3000. We're going to take a quick break, and on the other side, talk a little bit more about the kidneys and how nutrition plays a role in kidney care on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor show, Living a Longer and Healthier Life. We're here with Dr. David Selzer, internal medicine with NYU Langone Medical Associates in West Palm Beach, on Clematis Street, right downtown. So that is must be an amazing office. I have to come by there and say hello because that's my area. That's my stomping grounds right there. I love that area. Before the break, I just wanted to ask, does nutrition play a role in kidney care?
So yes, the more you have low salt diet, so that you don't develop hypertension, and the more weight you lose, and the more you control your diabetes through diet, the better off your kidneys are going to be, and the longer the engine, as they would say, will last.
Okay, so that's super important, nutrition and kidney care. Let me ask you the other part of kidney care that is dialysis. How does dialysis work?
So before we get into dialysis, I think we have to understand what are the main functions of the kidney, and then our viewers will be able to understand what dialysis does. So two of the main goals of the kidney is to get rid of fluid via urination, and the other is to make sure a person's electrolytes are in balance. So the person who has to go on dialysis, their kidney function has either permanently or temporarily stopped. So the dialysis machine has to take over for the kidney. So there are two aspects to dialysis. One is there is a countercurrent mechanism where it takes the person's blood and it goes against a preset formula, and they sort of swish against each other, and the idea is that they should mix. So let's say we want normally the potassium of a person to be 4, hypothetically. In a dialysis patient, you can't get it down. So they're typically at 5.5 or 6. So they take a preset bath of dialysate, and they keep that bath at 2K. So when they mix, they should end up at 4K. They can do similar things with sodium, similar things with acid-base disorders like bicarbonate problems and calcium. The kidney's job is to get rid of excess amount of electrolytes. If they can't, because it's not working, you need to have dialysis. And on top of it, while the fluids are mixing with each other, you have to get rid of the fluid that normally would get excreted from the body, and therefore the dialysis will help remove fluids. So there's different types of dialysis. There's the classical type of dialysis where a patient goes to a dialysis center 3 times a week for 3 to 4 hours a day, depending on their body habitus and what they ate and drank over that time. They walk in there, they get measured, they get stuck by the nurse, and then they sit there for 3 to 4 hours, watch some television, and then they get reweighed again, and the process happens every Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday, depending on what time of day, at what schedule they can be on. Then there's home dialysis. So that can happen where the patient sort of does it all on their own, and they do it at home. And it can last for 3 to 4 hours each time, and that can happen 5 to 6 times a week. There's also something in the middle where it's called peritoneal dialysis. So that goes through the abdomen. Typically, it's done at night. And instead of having the fluid mixed sort of with dialysate through your arm in sort of a venous and arterial connection, you have your stomach sort of form that barrier. And that allows you to be able to, once again, do our 2 jobs, which is to mix the electrolytes and sort of get rid of fluid. One thing that people don't like about it is that it makes their bellies look bigger because all of a sudden you're full of fluid. So that's the reason why it's a little bit frowned upon or not the most popular type.
That is, again, fascinating. I only knew about classical dialysis. I had a coworker who had to use that path for a while. But, yeah, thank you for explaining that. That's just amazing. So that's how dialysis works. Now, do you have any experience in helping in the process of kidney donation?
So, yes, I do. But before we go into it, I just want to say that those people who donate kidneys and the physicians and nurses and social workers who are involved in it, they deserve a special place in this world because they're really performing on a daily basis a medical miracle. They essentially give people an entire new lease on life. How often does someone have a bad disease and they can just wipe it away with a brand new kidney or a brand new car, essentially, for their body? I had the privilege of working in Cornell University last year for 2 months, and I worked with Dr. Anthony Watkins, who ABC focused on in one of the shows, New York Med. He was a fantastic surgeon, just a phenomenal person to work with. And at Cornell University, they did an excellent job of treating patients who have kidney disease and doing transplant nephrology. It was a phenomenal experience of seeing pure giving in the medical arena.
And I just want to share Dr. Stewart Himelstein, who's been on the show twice, an internist, internal medicine in Delray Beach, actually has been on the kidney list for about, I want to say 6 years, maybe a little longer. He actually had a, last week he was called and he was told to go to the hospital and that the kidney transplant was going to happen, but and there was all this excitement on Facebook. I saw it pop up and everything, and a couple hours later, and he really explained it. So the transplant surgeon, there was the tissue matchup just didn't work at this time, but he's still on the list, and we hope we can report in the future that Dr. Himelstein gets the kidney transplant. So I just wanted to mention that because it kind of tied into that question I asked you during the break if I could share that. So thank you. Going into that, how do people live with just one kidney over time? Like, that's an amazing story in itself. We know Dr. Himelstein 6-7 years. I mean, how is that possible?
Well, when you only have one kidney, it sort of hypertrophies, means gets bigger and stronger, and it does the job that's needed. It's more of a stress on that kidney, obviously, but when push comes to shove, it's amazing what a kidney can do.
So with, I guess a lot goes into that with diet, obviously abstaining from alcohol and other. So if a person's living with one kidney, they still have, I don't know if the word's restrictions, but they still have to watch over it a little. I've always been amazed when I've heard kidney transplant stories because I just can't imagine like a kidney being taken out of one person and put into another and everything hooks up. Right, and I know there's sometimes complications, but it just amazes me when it works and you see these stories of people down the road. It's fascinating. Again, I keep on using that word, but it is.
The donors who give it, it's such selfless donation, and they're not getting paid. They're just doing it because they are good people who have great hearts, great souls, and they just want to help another human being. So for all those people who are considering giving a kidney, it's a truly altruistic gift, and I commend anyone who does such a thing.
And thanks for mentioning it's Dr. Anthony Watkins. I actually typed it down. Okay. I got that right?
Yes.
Cornell as well, because I'm going to look that up after the show. That is amazing information. Now, going on from one kidney, there's a lot of talk out there, and this is actually UTIs, urinary tract infections. I've heard this before. Drink cranberry juice and flush the system and this and that. Is cranberry juice really good for the kidneys, or is that a myth?
Studies show that yes, it's a myth.
Especially because normal cranberry juice is loaded with sugar. At least the diet one that I've recently found at the grocery store on that aisle, it's more expensive, but when it goes on sale, I get 2 of them. So diet cranberry, I mean, probably has a little less sugar, but cranberry juice, fruit juice is sugar.
I mean, when I say that studies show that they aren't good, that there's no real proof to it, that study is over 1,000 patients, 500 patients. But at the end of the day, you're patient 1, and if it makes you feel better, who am I to stop you as a physician?
Water's still the best?
I think water and hydration is number 1, but you also always need something to a solvent to make it be absorbed. So sodium and sugar does help, yes.
What about Gatorade? A lot of people, you said electrolytes like 5 times. I'm thinking Gatorade every time.
Gatorade does have a lot of electrolytes to help replenish you, but I don't want to give a plug for them because they make enough money without me.
Yeah, and there's sugar in Gatorade.
There's sugar in Gatorade.
We only have about a minute and a half left. I got to have you back on the program because
Thank you.
This has been great. So I'm going to go a little bit in the lightning round. Coffee and kidneys.
Makes you pee. Because it blocks antidiuretic hormones. So essentially it blocks the blocker. Kind of like if your urine is a running back, coffee is the tight end that blocks the middle linebacker. So you block the middle linebacker, boom, you pee.
Oh, you could tell I played football, huh? So
yeah.
I understand that. Oh, we got a minute, even though the music's playing. On your website, there's a long list of conditions and treatments. I'm going to give that out. What are your hobbies and passions in life outside of medicine? We got about 45 seconds.
Married to the most wonderful wife in the world. My wife, Jodea. She's a true woman of valor. And she blessed me with a beautiful and amazing 2-year-old daughter, David P Selzer. We really enjoy going to aquariums because she loves the fishies and the turtles.
That's cool.
So it makes my daughter happy, it makes me happy, and we're one big happy
I read
family.
that in the show notes and the emails between us. Thank you. That is great. Again, Dr. David Selzer, Internal Medicine, 561-365-3000, nyulangone.org/doctors. You'll find him there. He's in West Palm Beach. Thank you, Dr. Selzer.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the